My name is Arthur Riba. I'm Medical Director of the Cardiac Care Units and Cardiovascular Quality Management at Oakwood Hospital Medical Center in Dearborn, Michigan. Well, I don't see, any new treatments on the horizon. A lot have come and gone. We had a lot of hope every meeting there's a new treatment, but it has not been shown to reduce mortality. So I don't think it's going to be that, at least in the next year or two. Again, it's public awareness, public getting the message out, getting that total ischemic time. Again, there's been 2 studies published already that a New York registry that if you waited 4 hours, you can get the greatest no matter what the daughter balloon time, mortality didn't change. So I think it's, how do we get this message out? We know why people delay, but how do we get that message out? Public awareness campaigns have not been very effective, the billboards, the things like that. But we need a very innovative way, whether it's going to be social networking or something like that, that's going to get people to say, and we've seen people that have gone through this 3 times and yet still sit there and delay and hope that it's going to go away and wait for their loved one to come on or drive themselves. Driving themselves is crazy. Again, we've got to have a guideline. We have to have a practice guideline for patients. You have chest pain. If you have a nitro, 1, don't take 3 or 4. You have an aspirin, take it and call 911. That's your safest bet. And if it's going to be more chest pain to the emergency department, that's false alarms, so be it. But at least you're going to save lives. I think that's going to be the only way we're going to further chip away at this mortality.
What do you think has been such a barrier for this measurement to happen? It's been in the guidelines, I think, since 2000.
No, I think it's the patient. I think the patient's the problem. And again, to me, it should be symptom onset, or symptom recognition by the patient. And what we're trying to do, because I want to try to, we have this ability in this community to try to influence that, because we sort of have a market share of the health here. And so trying to come up with, and we're asking EMS to document to ask each patient, what is the, when did your symptoms start? And then when the patient comes in and after they go to cath lab, we'd like to put in a questionnaire and survey to interview every patient to see what were the barriers and the reasons and the psychosocial, behavioral, and clinical factors. And there's a whole, I was surprised when I just did a literature search on this. I thought there was going to be very little, but there's actually a lot. How do you even get this data to begin with? So I think the first thing we're going to need to do is ask EMS to put into place, when they document the symptom onset, they will have everything from that point on, for when the activation comes in, when they arrive, when they assess the patient. Those timelines with with computer entry that EMS does, it's incredible how those timelines are well documented. We've got to work on that timeline to be a recall. But again, there are multiple gender, age, psychosocial, behavioral, clinical factors that have to be entered into this, and some behavioral modification, motivational techniques, understanding the clinical and psychosocial reasons are going to answer that.